Now that's good. That's good. That's dull. 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 Ah, so it turns out that that's lung and that's the span of the liver. Now, we know that it's 6 to 12 centimeters. So let's measure this. Could someone hand me the little Jaeger chart? That has one. Great. Now, I'm guessing that we've got about 7.5, maybe 8. Margarita, not bad. 8. Good. Now, let's do the spleen. Not required, but let's do it. Now, could you move over this way? Thanks very much. All right. Now, if you put your hand over your hip like that. Good. Now, the ribs go this way on the side. Now, let's see what you think. That's the stomach. Did you hear the difference? Mm-hmm. Okay. That's your spleen. Right there. Let's do that again. Okay, there's your spleen right there. Ha! Okay, now that's your abdominal exam. How hard is that? Pretty easy. Now, let's do range of motion of the lower extremities. Now, oh, you don't have to do a thing. You just relax. This is good. Now, we'll do one leg. Now, what I'd like you to do is bend your knee and bring it to your chest. Now, notice when you do this, you're getting 2 movements at once. You're getting hip flexion and knee flexion. Now, bring your leg out toward me. We have abduction. Good. Now, straighten out this leg. Now, cross this leg across the other. That's adduction. Good. Now, we have to do hip rotation, so let's try this. Could you let your knee fall out? Okay, good. And then cross it over that way. Any pain?
Nope.
Good. Now, the next thing that we need to look at is range of motion of the ankle. So, can you point your toe for me? And then bend your foot up. Now, can you curve your foot in like that? Good. And then to the outside. Now, can you make a circle for me? Circle. And then the other way. Now, what else could I do while I'm here? The pulses, of course. So I'm going to check. +2 pulses. And the posttibials are +2. Now, could somebody hand me a towel? Yeah, thanks. Yeah, perfect. Now, this is the golden opportunity to do what's called the Babinski, and also to check for clonus. Now, when I hold his foot like this, if he had neuromuscular irritability, like a central lying lesion, his foot would flap like this, in this position against resistance. Now, we all remember the Babinski, right? And we'll do that with the bottom of the reflex hammer. Okay, so that's range of motion of the lower extremities. Plus we checked pulses, we checked clonus, and we checked Babinski. Now, let me check strength. Can you lift up your leg against, now, what muscle is this? The quad. Now, bend your leg. Now push down across my hand. Push down with this leg. The hamstrings. Now, push against my hand. Push, push, push. Okay, pull, pull, pull. Okay, so this is a good way to check for gross muscle, strength of the leg, and the feet. Now, could you sit, please? Now, does everybody figure out what I'm doing now? Range of motion of the upper extremities. Okay, now, let's bring your arms forward like this. Okay, kind of like this. Okay, and back like that. Okay, all right. Lift them up all over your head. Cross them in front of you. Scratch your neck. Scratch your back. No pain?
Nope.
Terrific. Now, can you bend your arms up and down? Now we're going to do some hand motions.
Okay.
Okay, up and down, in and out. Make a cup. Throw out the soup. Open up your hands. Okay, close them. Flex. All right, now we'll do strength. Now that was range of motion, nothing more. All right, now push up as hard as you can against my hands.
Okay.
Now, what muscle am I testing, Joanne? Look at these, biceps, and good biceps. Now, push down as hard as you can. What muscle's that?
Tricep.
There you go. Now, let's test the strength of the wrist. Push, pull. Now open up your fingers against pressure. That's a good hand grasp, but do this. Open up your fingers.
Okay.
Spread them apart. Good, there you go. Now make a ring. Don't let me break it. Okay, so his strength is 5 out of 5. Now, the next obvious thing would be to do reflexes, and this is so much fun. Okay, let's get a reflex hammer. Wow, it's been waiting for me. Now, we'll do biceps. Now, this is going to be kind of fun for you. The biceps tendon anchors the muscle. Now, you don't have to do anything, Julian. I'm just going to stretch this and relax the arm. Relax the arm. Okay, there we go. That's perfect. Now, when you engage the tendon the way I did, you'll get great reactions. Now, I'm going to take the triceps. You see how I've got it cocked? You see that? That's relaxed. See how it's engaged? I've been practicing this a long time now. Just let your, now this is a brachioradialis. Did you see the little twist? Now, what do these test? I'll teach you how to count and remember what you're testing. Now, Achilles tendon is 1, 2. So that's sacral 1, 2. That tests the nerves, sacral spinal nerves, S1 and S2. Then this is 3, 4, lumbar, L3, L4. This is cervical 5, 6. This is cervical 7, 8. And this is cervical 5, 6, brachioradialis. So what am I talking about? So what I'm saying is that the spinal nerve that comes out at C5 is tested by doing either the biceps or the brachioradialis. Because remember, each spinal nerve has a sensory nerve. When I hammer the tendon, sensation goes in and the reaction comes out via the motor nerve. That's pretty neat. Now, what I normally do then is I do the cerebellar. Remember, the cerebellum governs coordination and movement. And I'll give you a couple of choices of doing 3 things that will test the cerebellum. No, we'll do one for the upper and one for the lower. Now, the basic would be this. If you put your hands on your thighs, I'd like you to flip-flop your hands like that. Okay, terrific. So I know that the cerebellar function for the upper extremities is fine. Now, another fun one is you'll recognize from COPS, the late night TV program. Now, put your finger on your nose, your right hand, right hand, right hand.
Right hand.
Yes. Now, I want you to touch my finger and go back to your nose. Okay? Now, we know that someone who's on drugs can't do that. They'll overshoot. Good. So that works perfectly. Now we're going to do some other nerve tests. Now remember the one that we did for cranial nerve 5, differentiating between soft and dull? That's actually going to test one of our sets of nerves. And then we're also going to do vibration. Now vibration is super because we finally can use these pitchforks. Now, I know you feel those vibrations.
Oh, yes.
Yeah. Believe it or not, a diabetic might not be able to. So what we'll do is we'll test the posterior columns by explaining the patient to the patient, okay, I'm going to put the handle to your hand and I want you to tell me what you feel, but you need to shut your eyes. Ready?
On the left index. Oh, yeah,
Okay.
right index.
So the right posterior columns are working, and then you do that with the left. So that's one way of checking vibration. Now this is not the entire neuro exam, but it's like almost 99%. Next thing we need to do is to check L3, L4. So how do we do that? The patella. Now, sometimes people can't relax. You're good at relaxing. Very good at relaxing. Now, if it's the end of the day and people have stinky feet, they're not going to want to take off their shoes, but you can still test the S1, S2 by picking up the shoelaces and lifting the foot like this. You do not have to help me. Now, look at the tip of the toes, point down. Now, you're helping me. Okay. Now, this is a distractor. Now, put your fingers together like this and pull, pull, pull. I'll do all the work. Okay, did you see that go down? The foot paws down like that? That's it. So you're 5 out of 5 in terms of your strength. And you're +2 out of 4 for all of your deep tendon reflexes. Okay, now what we can do is we can check your gait, and we can also check you for scoliosis. So if you could stand right there with your back to me. Good. Now I'm going to compare the height of his shoulders, the hip bones, and the gluteal folds, and actually he's completely even. So I don't see any obvious signs of scoliosis. Now, can you touch your toes, please? Now, I've got my, oh dear, oh dear. We'll get those for you. Okay, yes. Are they okay? All right, now come up slowly. Oh, that was fast. Try slowly. Thank you. Come up slowly. Now, notice that my fingers didn't make a curve like that because his spine is straight. Now, put your legs together as closely as you can. Now, some people have what's called genu valgum. In other words, they're knock-kneed. Now, I can get my fingers between his legs so he's not knock-kneed. But on the other hand, he's not bow-legged either, and that would be genu varum. Okay, great. Now, the one movement that I did not test would be hyperextension of the leg. Can you move your leg back like that? Hold on to the table if you need balance. Good. All right. So that's how you can get to hyperextension. Now, I normally have that person walk down the hall, so why don't you come with me, and I'm just going to watch his gait. Now, what I'd like you to do, first of all, is I'd like you to do heel-toe walking for a few feet, okay? Now, this is cerebellar testing, isn't it? Julian doesn't fall over. Yay! Now, could you walk back towards the Schnellen sign?
Okay.
Normally, okay? Go ahead. Great. Now, tandem walk is wonderful. Now, here's the last piece. We're ready for Romberg. This is the crowning exam. Now, we put Julian into a corner so that he doesn't fall over. And I'm going to do two things at once, just so you get it. Now, I'd like you to keep your arms up like this and shut your eyes. If he had a lesion in the ear or the labyrinth, he would start to move over this way with his eyes shut. And the reason is you use your eyes to keep yourself in balance. And when the eyes can't do that because your eyes are closed, what happens is that a person, if he has a lesion in the ear, the labyrinth, or possibly in the cerebellum on the right, he's going to sway right. If it's a left-sided lesion, he sways left. So there's no swaying. Now, does anybody recognize this as pronator drift from our stroke tests? Does anybody recognize this? Yeah. Because if he had a stroke or weakness due to expanding right lesion, this hand's going to do this. If it was a left lesion, this hand is going to fall. That's it. Now, that wasn't that hard. Now, what you need to focus on is making it smooth from, lungs to heart. Do the abdomen. Now, I'll go around and I'm just going to check out the three principal things, which will be percussion, the liver palpation, and the liver percussion. And then practice the motor on one leg, because that's what we need to do next week to get you ready and finished product by next week. Now, I have to tend to these other students.